Welcome everybody to this Center of Mindful Eating, Yoga and Mindful Eating for Kids webinar presented by Claudia Vega. My name is Guga Sinovich and I'll be your host for today. Thank you for joining us. Before we begin, I would like to briefly give you some background about the Center of Mindful Eating. TCME was created for professionals who want to learn about the value of mindfulness and mindful eating. The Center of Mindful Eating does not promote or advocate one single approach to mindful eating. Rather, we are committed to sharing ideas and practices, clinical experience, and research. I would like to take the opportunity to thank those who are members of the TCME for their support and membership. Without you, we wouldn't be able to be here. We have numerous resources available for you on our website, including a full archive of talks, publications, networking opportunities, and more. If you need any assistance accessing your TCME resources, please contact us at info@tcme.org. Everyone who is attending today will receive a CPE issued by Skelly Skills. A short survey will be emailed to you following this presentation where you can obtain your certificate. The Center of Mindful Eating is a non-profit organization that is member-supported. Your membership not only provides an extensive list of benefits, but also helps support our free programs that are open to the public, like this one, helping us to meet our mission and providing education resources to learn more about the practices and benefits of mindful eating. Thank you for being part of the Center of Mindful Eating. And now I'm delighted to introduce Claudia Vega, who will be presenting a Yoga and Mindful Eating for Kids webinar. Claudia is a pediatrician, nutritionist, and psychotherapist. She specializes in working with children, teenagers, and adults who have eating or weight issues. Claudia also works in prevention of eating disorders by raising awareness about the risk factors such as body dissatisfaction or low self-esteem based on appearance. Dieting negative talk among children and or their parents, and also by increasing positive attitude such as non-appearance oriented self-concept, and replacing restrictive dieting with more balanced and mindful relationship with food. For such purposes, she gives lectures and mindful eating workshops to preteens, teenagers, and their parents. Claudia is the creator of nutriintegra.com. So any question you may have, you can also write her into this email address. And now I give the chance for Claudia to present this webinar. Hello, Claudia.
Hello, Kuka. Thank you very much. Thank you for the introduction, and thank everybody for being here, for being present today, for making the time to join us. Well, so that we can receive this webinar, whatever it is that we can take from it, I would invite you to start by giving ourselves the chance to open our hearts and our minds and settle in so that we can be open to whatever might come during this webinar. So if it feels okay for you, I invite you to just leave whatever it is that you are doing or whatever you have in your hands and take a comfortable position, like sitting, or in the case that you're laying down, you can continue laying down, just giving yourself the chance to close your eyes if that feels okay for you, or just simply softening your gaze, placing it somewhere in front of you, and bringing your full attention to your posture, just without changing anything, noticing how it is that you are right now. The points where you're making contact with the surfaces your feet, where they are resting, your hands, your back, your legs. And without changing anything or judging, just becoming aware of the space you occupy in this moment. And bringing your full awareness to the physical sensations as you inhale and exhale. Sensing the air coming in through your nose, the expansion of your chest and your abdomen, and the physical sensations as you exhale, how your belly goes down and how your chest deflates. And wherever is more vivid for you to sense your breathing, just rest your attention there for the following breaths. Nothing to do, nothing to change. And of course, the mind may wander. That's what minds do. That's fine. Just noticing it and escorting it back gently to your breath. And now taking a deeper in-breath. As you exhale, when you're ready, gently, little by little, opening your eyes. So welcome everybody. I'm going to share with you this webinar on mindful eating and yoga for children, a path to develop a good relationship with food and eating. So this is more the recommendation that I have for you based on what literature has shown and also a little bit on my own experience working with children. And of course, as Kuka said, at the very end, we're going to open space for discussion, for sharing some insights and answering any questions that you may have. So it is not surprise for us listening to this webinar that a lot of people suffer around eating, right? A lot of us are here either because we ourselves have experienced some sort of suffering around eating or because we work with people that suffer. According to this survey, only 40% of people report they enjoy eating. Eating enjoyably comes loaded with guilt and fear. For many of us, at some point of our lives, this guilt comes out of the idea that we were not able to control a pattern, a behavior, or fear of putting on weight or not doing it right, etc. So instead of using food for nourishing ourselves, our bodies, our minds, our spirits, many times we have difficulties with this activity which actually supports our lives. But adults are not the only ones that suffer or have problems with eating. 25 to 30% of infants and toddlers experience non-clinical eating problems. And when I say non-clinical eating problems, we're talking about situations that are not necessarily eating disorders or obesity or some clinical problem that you would seek treatment for, but that certainly causes struggle in the children and in their families. And as Ellen Satter says, when the joy goes out of eating, nutrition suffers. right? So eating disorders and obesity, we're going to talk a little bit about statistics on these situations. Some people have suggested that eating disorders and obesity are the two sides of the same coin, the two extremes. On one side, we have people restricting, worrying about how much they eat, always checking their body weight, etc., having a lot of pain and difficulty with their self-image or body image. And on the other hand, we have people that also have difficulties with self-esteem, with body image, but simply do not know how to stop eating. And the reality is that in the both extremes, there's suffering. And it is estimated that 1 to 4.2% of United States women have suffered from anorexia and up to 4% from bulimia at some point during their lifetime. And for a lot of us, that may seem like a very little percentage, but these are mental chronic illnesses that can actually threaten the life of a person and are surrounded by a lot of pain, by a lot of suffering, not only for the patients, but for those surrounding them. And men, even though eating disorders are more prevalent among women, men are not an exception. Like they also can struggle with anorexia up to 3%, with bulimia 0.5%, and with binge eating disorder at some point in their lifetime. 2% of men will struggle with binge eating disorder. So in general, we have this statistics that says 2.8% of American adults will struggle with binge eating disorder at some point in their lives, and only 43% of individuals will receive treatment. And this is very important when I say only 43% will receive treatment. Actually, for a lot of the eating disorders, the diagnosis can be delayed up to 7 years. And a lot of people never get diagnosed. A lot of people get diagnosed but still do not get treatment. So either if we have a clinical syndrome, a clinical picture, or a non-clinical difficulty with eating, suffering is very prevalent when it comes to putting food in our mouths. 83% of overweight or obese people, according to an Australian study, are eating out of emotion. So they're emotional eaters. So on the one hand, we struggle with eating, but we also use food as medicine for our souls. And what happens with children? Well, it's been shown that for parents who have issues with eating, it is even more difficult for them to feed their children in a healthy way. Even though it has been studied and actually proved that there is this beautiful recommendation, the division of responsibility that Ellen Satter developed and researched about and has been recommended about what parents are supposed to do and what children are supposed to do when it comes to eating. This is called the division of responsibility. And although it's been published and it's been recommended, it is not very often implemented. According to Ellen Satter and her division of responsibility, parents are responsible for the what, when, and where of feeding, while children are responsible for how much and whether of eating. So what happens is that even though we know and there has been a big body of work around this, either professionals are not informing the parents, or the parents feel not understood, or they just simply do not know how to do it once they are in the house. Fear kicks in, and for as much as I know, a healthy, mentally healthy parent will not want to cause any problem to her children or his children. But when the kids are not meeting the expectations of the parents around eating, they get nervous and they start putting pressure on their children, right? So although it is, of course, understandable that parents out of love have these behaviors. They probably do not know what consequences these behaviors, these parenting styles or feeding styles will have in their offspring. Almost all parents of preschoolers limit menus to the foods that the children already accept, and then they bribe them and pressure them to eat. So on the one side, we put pressure on them, and on the other side, because we do not want to be in conflict with the children in the table, we let them just pick whatever it is. So we are not following the division of responsibility. We are not deciding the what. The children are deciding the what. The quality of food that we are offering them many times is not the best quality we can offer them. Over 90% of parents, on the other hand, do not believe their children when they tell them, hey, mommy, I'm full, I don't want more. Normally what we do is, please eat a little bit more, or even the extreme. You won't get up, you won't leave the table until you clean your plate. Does that sound familiar? I remember growing up with that phrase in my mother's lips, and I know, as I said before, she did it out of love, but sometimes fear kicked in, and of course the message came out a little bit twisted. So children learn from what they see and from what they hear. But it's been shown also that pressure does not work. Pressured children eat less well and behave poorly during meal times. So this perpetuates the vicious cycle of a parent putting pressure on the child and the children rebelling and creating problems, and that increasing the anxiety and the frustration of the parents. We can find a lot of this research in the Ellen Satter Institute webpage that I would really recommend you to visit. It's very, very lovely. So either because we as parents teach our children from our own experience, because our only point of reference is our own story as children, or because children simply do not have this orientation, whatever the reason behind it, a lot of times eating is not fun for them. As I said before, approximately 25 to 40% of children experience difficulties around eating, like fuzzy eating, food refusal, neophobia, which is the fear of tasting or trying new foods. But also, on the other hand, we do have clinical disorders like eating disorders in little ones. Up to 2.7% of teens from 13 to 18 years of age struggle with an eating disorder, and that is a remarkable incidence. Why? Well, because unfortunately, for a lot of us, the patterns that we have around eating while we're little, while we're young, while we're children or teenagers, will continue to be there when we are adults. Over 50% of teenage girls and 33% of boys are using restrictive measures to lose weight. What is this telling us? This is telling us that at a very young age, little people like our children, are already worrying about their weight, their body image, looking for a way to fit into this society that has taught us that a slim figure, a slim body image is what really matters, right? Like some of my patients would say, boys only look after thin girls. And that comment is not only of patients with eating disorders. Unfortunately, a lot of girls, as I said before, that may not have the full criteria to be considered an eating disorder, but are still struggling with eating, are thinking this way. So we have to do something about this. We have to start changing this paradigm and start bringing awareness and shifting the self-perception that kids have and where the value comes from, and it is not the physical aspect. 46% of 9 to 11-year-olds are sometimes or very often on diets, and guess what? 82% of their families are also on diets. So as I said before, we learn from our environment. And this is important for us professionals to keep in mind when we are giving advice to the parents of our children that are coming to us because they have some difficulty around eating, or just if we, in whatever it is that we do, if we deal with families, it is important to mention these situations and guide them through them. So why mindful eating for children? Why we in the Center for Mindful Eating recommend this? Mindful eating, as we all know, has been more used with adults, and it has been researched with adults. The research with children is just starting. But in the research with adults, we have encountered that mindful eating helps us develop a better relationship with food, develop a better relationship with ourselves. So that puts us in a position of where if I know what are the triggers for me to eat, what are the emotions and thoughts behind my eating patterns, what is that I'm suffering from, I'm going to be in a position of actually making changes. I first have to know what is going on with me in order to make a change. And the research has shown that mindful eating is helpful in binge eating disorder. There's not conclusive yet, right? I said with big capital letters yet, because one thing is that something is not proven yet, and another thing is that it doesn't work. So we are in diapers, we say in Spanish. We're just beginning with the research. But it has shown positive, favorable results in binge eating and bulimia, and we're working also in the weight management, right? Mindful eating is not a diet. It is not intended to lose weight. But when we start having a better relationship with food, one of the things that may or may not happen is a change in our weight. Well, from that point, we bring this to children. And my experience has shown me, my experience is nothing. I'm just one person, right? But what I've seen working with my own children and working with my patients is that when children are allowed to, they can explore, experiment, and discover through food different ways of nourishing their minds and bodies. Kids as young as 10-year-old can tell you something like, oh, I didn't know that I was going to like that food. I've been saying I don't like it all my life. And then they have the opportunity to taste something, and voila, it is not as bad as I thought. Or I have had girls that are 13 years old that have come and told me, you know what, after doing that exercise you taught me the other day I noticed that I was very upset. I was actually mad at something my mom told me. And I noticed that when I was searching for food in the pantry. I realized that what was going on with me is that I was mad. So I went up to my room and I stayed there and it went away. Later on, I came back downstairs. I talked to my mom and everything was fine. So 13-year-old telling you that for me is light that mindful eating can help. But why? Why mindful eating? Well, through mindful eating activities, the kids learn to be present, intentionally present with food. They cultivate curiosity. They allow themselves to explore and even play. There's nothing wrong with playing and making a mess. Every now and then is fine. So they start to explore food and they start to explore their own experience around eating, as I just mentioned with this teenager. They start to see their thoughts, their feelings, and their emotions around eating. So they develop a connection with food and with eating that offers them an opportunity to learn not only about themselves, but also about the world they live in and their connection with other beings. They become mindful about their consumption. They become mindful about what took, all that was involved before that food was put onto their plates. Through mindful eating exercises, children as I said before, literally get to know the food. They use their sensorial organs to see, smell, taste, touch, and hear the different types of foods. And only then, when they start to really give themselves the opportunity to try something new or to check with their stomachs how hungry they still are or how full they feel, that's when they can decide how much they're going to eat and what is it they're going to eat. It's been shown that children need to be exposed to a food item 15 times before they become familiar with it. Another 15 times to decide if they like it or not. With mindfulness, they sense their bodies and then they can start feeling their stomachs and develop their internal cues for hunger and satiety. So they start putting the locus of attention within, not outside. The amount of food in the plate is no longer the referral. The voice of the mother saying, finish what you have there, is no longer the referral. If they are provided with a good environment in which they can openly communicate what they feel and need, they can say, Mom, I'm full. Mom, I'm eating mindlessly, right? You don't believe it? It is surprising what they can say. Children are mindful already. It is that when we grow up, we disconnect from the wisdom of our bodies. Children are already mindful, and with mindful eating, they just learn to perpetuate that wisdom. Also, in different research articles, it's been shown that behaviors, when they are practiced or when they're learned in groups, are reinforced by the peers. So I have had groups where probably only one kid would eat broccoli or one kid would eat beets, and one kid would be enough to start the whole group giving themselves the permission to try it. And guess what? They discovered, some of them, not all of them of course, some of them discovered that they liked something that they had never even tried. Children are too often told what and how to eat, but by us, the parents. And a lot of the times, as I said before, they rebel against these post instructions. So when they start to develop this body wisdom and this opportunity, when they start discovering and exploring this opportunity with food, they eventually will try, and they will. Sometimes they won't try it all, but it is like opening a door. Once they tried something new, guess what? They will for sure at some point dare to try something new again. Mindful eating offers the opportunity to explore food individually, but also in the presence of others. And mindful eating activities can be fun and inviting. And that's what we want. We want to take away the struggle around eating that many parents have on their tables, right? Instead of eating or mealtime being a time for connecting, for finding out how it went in school today, how are you doing, how are you feeling, many times food becomes the object of our attention, and the behavior around eating of our child becomes the object of our anxiety. By letting children explore food, they can also start learning how to prepare it, how to put it on their plates. They can start deciding how much they want to put on their plates. And all these different aspects help them develop a sense of autonomy. Let's remember that children are growing human beings, developing human beings, and autonomy is a human need. So through giving them this opportunity, we're also giving them the opportunity around eating. We're also giving them the opportunity of feeling capable of deciding, of choosing. And it is always good to have choice, right? So knowing and listening to their own bodies, souls, and minds, they can decide for themselves what is good for them and what is not. Well, that's the tricky part, right? Many times we parents do not feel confident that we can trust them. We do not know if they will do it right. Well, guess what? That attitude is our thing. That is based on our own fears. And that's something we and only we can work on. Learning about food and the environment that they can be more mindful of their consumption, as I said before. When we do these activities and we talk about, let's say, how cows are raised and how they're sacrificed so that we can eat them, many times children would look at their plates and think about it. And this is not about making them feel bad about their food. It's just to become more aware or more conscious about how they consume. Because many times food ends up in the waste basket, right? So we just want them to also be aware of how their behaviors impact their environment. And why yoga? Why mindful eating and yoga? What does eating have to do with the body movement? Well, it has to do a lot. Through yoga, not only kids, but we adults get to feel our bodies. Many times we live up in our heads, thinking, planning, remembering, judging. And when we are too much into our heads, we are disconnected and away from our bodies. So how can I know that I'm hungry when I don't even feel my body? How can I know that I'm angry when I don't even know how anger feels in my body? Through yoga, children start to not only develop physical strength and flexibility, but they get to know their bodies, they get to know their limits, and they get to respect their limits as they are. And here I want to say something important. In yoga, we say flexibility is not only of the body. Many times while doing yoga, we just can't stretch more, and the mind immediately kicks in with a judgment or with an idea, with a thought. And guess what? Flexibility is also of the mind. When I know that my limit today is this, and I accept it as it is, I put myself in the path of changing it. But I cannot change something that I don't know. So through yoga, we can feel our body, feel our abilities, and also our limitations. Interoception is defined as the capacity that we have to actually feel and sense and understand the physiological needs of our body. It is different from proprioception, which tells you how you are in your position, in the space, even if you close your eyes. How do you know that you have a foot if you don't see it? How do you know where your elbow is resting if you don't see it? Well, that information comes within the body. But so comes the information about what our bodies need. And practices like yoga, body-mind practices, help us develop interoception. So by being in my body, by landing myself in the physical sensations of the different parts of my body, I can feel something like my heartbeat, I can sense my respiratory rate, I can feel how full my stomach is, etc. And yoga is a very well received practice for children. Children are yogis and yoginis already, right? Child poses of yoga come for a reason. And when you start showing children yoga, they surprise you. I think we all can remember and relate with this, how we used to twist our bodies when we were little. So children know the poses by themselves already. But more than knowing poses and more than practicing asanas in yoga, what we're trying to invite you here to think about is that by practicing with moving and enjoying the body, we get to know it better. Yogi Bhajan says, when ego is lost, limit is lost. You become infinite, kind, and beautiful. And a little bit on the same tone of what I was saying before, The only way that I can expand my limits is by knowing them. If I know my limits, I will respect them. If I know that my body has a difficulty stopping from eating, or an emotion that is difficult and I can sense, I can start changing it. I have to be present with it first in order for it to transform. Yoga helps children understand their body's strengths and limitations. They can explore those limits in a self-respectful way. In yoga, we do not promote competition. We promote self-improvement. And self-improvement goes hand in hand with self-care, with self-compassion, with self-love. So from very little age, we're teaching our children to listen to their bodies, to listen to their souls, to respect themselves, to love themselves. Yoga also gives the opportunity for children to see that when the mind is wandering, the body is following the mind. If I want to be concentrated, if I want to be in my body, I have to pay attention. And of course, yoga is a mindfulness practice. Yoga is a mindfulness practice in movement. But we also have the side of yoga in which we actually look inside and start to see and integrate not only what we did with our bodies, but what we are doing with our minds and our souls. Through looking inside, we start to develop self-understanding. And of course, we're not going to expect a child that is 3 years old to have this big insight about something. But according to each developmental stage, children surprise us. We grown-ups are the ones that sometimes think that they can't understand, but little by little, they start to understand their emotions, to self-regulate, and to communicate in a more effective manner. But for communication, it takes two sides. We have to provide the environment. As parents, we have to make sure that our children feel confident and feel happy about expressing what they feel and think. Through yoga, we develop awareness of our thoughts, emotions, and feelings. We integrate mind and body. We have the opportunity to relax and experience the present moment. We let children, or they let themselves, explore and understand what's going on inside. So why yoga and mindful eating to develop a better relationship with food? Well, because as I said before, yoga helps children connect with their bodies. They become aware. They can tell what's going on. They can start working on their limits. They can start working on their emotions, on the difficult ones. Teenagers that are struggling with an eating disorder or are starting to struggle with these difficulties about body image, this body consciousness, they start to see and become more self-compassionate and understand that their value is not in what the scale tells them, that they are unique beings. They do not need to compare themselves with the other teenagers. And yes, it is difficult because teenage is the perfect scenario for human beings to compare themselves, to question what they know so far, what they've learned, to start to understand what our place is in this world, right? Teenage is a critical developmental stage. But if we, the grown-ups, provide the environment, if we prevent, even from before, when they're still children, and start talking about their value, that they do not need to compete, that they are valuable just for the reason that they exist, they will come to this stage with more tools to go through it. So the awareness of the body can help children understand their cues of hunger and fullness, what they like, what they dislike, how they can let themselves explore more and more foods and then decide. Why yoga and mindful eating for children? Because it's fun, because it is developed in an environment full of love and support. And because we move and we eat, right? We all do that. What a better way than doing it with awareness? And that's what yoga offers, and that's what mindful eating offers. I do not want to end this webinar without saying the importance of the family, remarking this, emphasizing on this, because we can offer children tools like we do, for example, in psychotherapy sessions, right? We are aware as therapists that we might not change their patterns. The environment in the house might be a difficult one. And so what we do is we try to teach the children to be resilient. But if the family is part of the treatment, if the family gets involved, if we all come with the same tone, children will do much better. So we need, as professionals or as parents, we need to address this. We need to promote family mealtime, family experience together, right? Like going out, we are all very busy, but we need to make the time to be with our children. It has been shown, it's not just me thinking this, it has been shown in the research that family meal times are associated with consumption of healthier food on the children's side. Of course, because they learn from what they see. We are their role models. If we are there, not only to role model, but to also encourage them without putting pressure, using the division of responsibility, letting them decide, and creating a love environment, our children for sure will do better. Mealtime should be an opportunity to connect, not an opportunity to fight. The table should not be the war field. The table should be the love place, just like the rest of the house. And here I would stop. I would like to open the space for questions, comments, discussion. Here I am, and I'm more than gladly to accompany and resolve any questions that you may have.
Thank you so much, Claudia, for introducing us into this magnificent world of connecting with our children through their food and their bodies. I would like to invite you all to raise up your hand if you have any question, or if you want to, you can actually write it down on the questions.
Can I say something?
Hi, Claudia.
Yeah, and also what may be a question sometimes is like how we do it. So how we teach the parents of the children we work with, or how we teach our children. So if you have any questions about that, please feel free to ask.
Okay. So I was reading a question from Summer Butler, and she says, although I prefer in person, are days my daughter asks to do yoga at times, 5 years old, when in person it is not an option. Do you have recommendations for online resources, videos, CDs, etc., to incorporate yoga more into our families or patients' everyday lives?
Yes, I actually do. There is this program called Next Generation Yoga. The author of this program is Jodie Comitor, and she has videos. She's worked with Gaiam, which is a company very popular for all the yoga videos and resources, and she's filmed a couple of videos for yoga for children. Actually, if you go to the website of Amazon and you click in uh, DVDs, yoga, children, you're going to find a lot of information. And there's also, if you're interested in learning more, or if somebody's interested in training, so to become a teacher for yoga for children, there's the program of Yori Komitor, there's Yoga Calm, which is what I actually, one of the certifications or programs that I trained in, that's in Oregon. Yoga Calm is great because it incorporates yoga and also a lot of therapeutic activities. And there's also Rainbow Kids Yoga, which is so much fun. And it's also another one that I had the opportunity to take, and it was just amazing. So yes, there is a lot, and you being in the US, if that's where you are, oof, you have a lot of opportunities.
Okay. Here comes the next question from Adina Kelman. Division of responsibilities. It is difficult to leave the how much to a teen diagnosed with eating disorder. How do you go about this?
Okay, thank you for saying that. Actually, when we're talking about the division of responsibility, we're using or talking about using it with children that do not have a particular situation like an eating disorder. Because, of course, with an eating disorder, we have to have the support of a medical team looking after us, right? That will give us guidance, that will work with the patient and with the family. And so in that particular case, if the person has an eating disorder and is not wanting to eat, of course, we're not going to say, oh, don't eat, right? In that particular case, we have to follow the strategies that are being recommended to us by the nutritionist, the therapist, the doctor, the psychiatrist, etc. Eating disorders are multifactorial and have to be managed in a multidisciplinary way. And family is a key component of the treatment and successful treatment of these situations.
Okay, thank you very much. So there's another question from Laura Stevens, and she says, what resources do you suggest parents reach to in order to encourage mindful eating and yoga?
Okay, well, I love
Sorry,
the food.
sorry. And
Sorry,
then she
sorry.
specifies her children are 2, 4, 15, and 16.
2, 4, 15, and 16?
Yes.
Okay. Well, 2 and 4, the work is pretty much on the mother side, right? In the sense of I would recommend that you yourself start to, if you do not already, that you start to practice mindful eating so that you actually know what it is, how it feels, and you can role model it with your children. You would use, in this case, I would recommend that you use the division of responsibility, which is giving yourself the chance to choose what is going to be eaten at the house. Like you're going to do the grocery shopping, right? So you're going to decide what is going to be offered on the table, when and where, ideally on the table, not in front of the TV in the living room, but on the table. And that you start to trust them in they are going to be the ones choosing how much, and what of what you offer is that they are actually going to eat. When you become a mindful eater yourself, you and also supported by research, not just by a good intention that I'm sharing with you, but actually by research, you will know that children up to 5-year-olds are the most capable in sensing their bodies and tuning with their own internal cues for hunger and satiety. So trust them. And with the older ones, well, again, we as parents are role models. I would recommend that you talk about this with them. Maybe even come to the table with an article about mindful eating. Teenagers love to be challenged in a way. They want research. They want something that is palpable. They no longer believe everything we say, right? So invite them to know about the concept, maybe invite them to read, model in front of them, and let's see what happens. But they're in a different stage in which, fortunately and unfortunately, they are more autonomous and we don't have as much influence, but we still do. We still help them and we still set limits for them. So explore.
Okay, so we've got Sally here who wants to ask you personally. So I'm gonna unmute the sound. So Sally, please go ahead and ask your question.
Hi, Claudia. Thanks for taking my call. I love your webinars that you always put on, and I know I've sent you emails saying just that. So thank you again. I'm really fascinated by this, especially I work primarily with teen girls. I'm a psychologist and a kids yoga teacher, so trained yoga teacher. So when I'm working with families, especially with teens with anorexia nervosa, and I'm thinking of one in particular with AN binge purge type. It's really a struggle to, it's obviously like a multidisciplinary team working with kids, but with parents, it becomes, they do feel like there's that pressure at the table, so they have to be pressuring. So I'm really struggling with one family in particular where it's, trying to get them to pressure less, but they also can't let their daughter leave the table immediately after a meal because, the daughter has said, dinner time, I know that I will purge if I don't leave the table, or if I leave the table within 15 minutes. So it becomes this, this fight always at the dinner table. So I'm just wondering how to give them tools for a more peaceful dinner, like how to help dad relax, mom relax. Yeah.
Okay. One thing, I'm actually, if you send me another email so that I have it handy, like that I can find it easy, I would like to share with you a link of an article that was just published at the end of 2015 about the conceptual framework on how mindful eating in a family approach can help teenagers. And this is for teenagers that do not have eating disorders. But basically from this article, what I can share with you and what actually made a lot of sense, and it's kind of how I like to work with my own patients, is I would work with children and parents separately. Like both of them, both groups would need to learn what mindful eating is so that they can actually understand in the case of the parents. But with the patient, as you know even better than me, there is this difficulty with the mind, right? The mind is always going on, and eating disorder patients live in their heads. So mindful eating here would be this opportunity for her to sense her body while you as a therapist is also working well with the cognitions and the thoughts and all those things that are going on in her head in a different moment, right? Mindful eating would be used for her to start to sense her body, to start to work on developing her internal cues for hunger and satiety, to also put their self-compassion, like using self-compassion to work with the difficulty in accepting herself. And then, well, you would use all the different strategies that you probably already used with, I don't know if you use CBT or what you're actually using with her, but I would do a combination. The first thing I would say that we want a patient with an eating disorder is to come down from the head and start landing in the body and start developing self-compassion, self-love. And with the parents, the same thing, right? I can only imagine the struggle they go through. They don't want the girl to have a problem, but it is crucial that they start to develop patience and well, to trust her, right? It's on the two sides you have to work.
Thank you, Sally.
Did that answer your question?
Yes, that's fabulous. Thank you.
I'll share that article with you.
Yeah, I'll email right away.
Good.
Okay, we've got a few minutes and we've got two more questions. Another one from Karen Wallace, and she was saying, What are the 3 short mindfulness exercises for children mentioned in the program objectives?
The 3, okay,
Short
well, there
mindfulness
are,
exercises that you're recommending.
okay. Well, I recommend the one on the racing. You can do it with, it doesn't have to be a raisin necessarily. I've done it with mandarin and with apple. So that they explore the 8 types of hunger. We're now getting up to 9 types of hunger now. So that they can actually use their senses and explore the food in a deeper way. Another mindful eating exercise, and I'm going to answer this question by recommending the book of Margaret Fletcher. There you are not going to find 3, you're going to find 75 activities that you can use to work with children. And the title of the book is Discover Mindful Eating for Kids. Another mindful eating exercise that I like a lot is like working like with a balloon, and you fill it up with water, and so you use the balloon as an external, like a visual cue for them to compare or relate with their own stomachs, so that they start to sense how full they are or how empty their stomachs are. And also there I do a variation. So once we have this, I use the balloon, and I say, I inflate it up to how I think I am right now. And then I would make them eat, and I would ask them to feel again, and then they would inflate it more or fill it more with water, depending on what we're using, so that they can actually start to understand that the stomach is related to volume, not to taste, because many times we eat driven by our mouths, not by our stomachs, and we do not pay attention until we're about to explode, right? So that they get it more clear that the stomachs are full with the food we eat, and that sometimes is not sometimes, it is always very important that we're paying attention to that when we're deciding how much to eat. And I also do a mindful eating exercise that I absolutely love, is with the raisin again, but it is about connection, how the raisin got to our hands, where did it come from? Because I like them to develop this awareness of our environment, right? When we are more mindful, we are not just more mindful about ourselves, we're more mindful about everything that surrounds us.
Thank you. And the last question, we've only got a few minutes left, and it's coming from Summer Butler. She says, when going to the pediatrician or doctor, how would you recommend weight is discussed or not in the presence of the child?
Well, that I think has to do a lot with the style of the pediatrician and with the relationship you have with him or her. If the tone of the consult or of the comment about the weight of the kid is in such a manner that the kid is going to feel bad, I would talk about that in person with the health professional and say what I think and why I think it. The way I do it, all I can tell you is the way I do it. The way I do it is when a mother comes with a child for her concerns about the child's weight, whether there is a problem or not, I do talk about this in front of the children in the very first visit. And I start by telling my children, because I call them my children, my patients, like mis niños. I start telling them, you are not here because we want to change anything about you. You are perfect the way you are. If there is a problem with weight or with food and eating, I address right there, we are here to help you change your relationship with food. I don't need you to be lighter or heavier. You don't need yourself to be lighter or heavier to love yourself. And I do that in front of the kid because that's the message that I want to direct to the parent. I want this to be echoed in the house. I don't want the parent coming here and once they leave this room, start telling the kids something about their weight. And after I do that, I do have a session, or maybe in the same session, I just ask the kid to go to the waiting room and I talk about this openly. If the parents are not in the same page than I am, then it's going to be very difficult to work with the children. The children's emotions, the children's self-conception is very important, and we have to take care of that. We have to appreciate them and love them for who they are.
Wow, thank you very much, Claudia. I think this is it for today. We've already covered the time that we have assigned for this webinar. I would like to thank you and the audience. So if there's any more questions, you can always address them to Claudia via her email. Can you please share with us your email, Claudia?
Oh, yes. My email address is, I'm going to spell it, C as in Cuca,
Yes.
as in Claudia, C, Vega, VEGA @tcme.org.
Okay, thank you so much. Thank you very much, everybody, for being here, for making this webinar possible. I'm going to end up this webinar right now, and we wish you a very good day wherever you are. Thank you.
Thank you,
Thank
everybody.
you, Claudia. Goodbye.
Thank you.